question?
Yeah, of course.
Okay, I'm interested to know, in surgery, I understand that leeches are still used in theatre sometimes.
Yeah.
So, under what conditions would you use them, and did you use them on me?
No. So they weren't used on you. No. And they're not. So leeches are generally, when leeches are happening, there is bad karma going on. It is not a happy world when leeches are being brought into the room. Leeches imply a blood supply problem. When we're moving tissues around, so if they're attached and we're just leaving them connected just by their blood supply and moving them around, or sometimes we detach that blood supply and then reattach it to a new blood supply somewhere else with very, very incredibly fine stitches, and we do that surgery under a microscope, and that's called microsurgery. The problems you can have after that with blood supply can either be too little blood going in or too little blood coming out, and either is just as bad a problem. It's more commonly the vein, too little blood coming out, being the problem. So blood is being pumped in and it's not escaping, and you wouldn't imagine that would be such a problem, but it's a disaster because the pressure inside these tissues swell, they become this deep purple, and they just can't survive like that, and they start to die. In comes the leech. Leeches just love a bit of tissue which is engorged, which has too much blood going in and too little blood coming out. That's its happy feast day. So you put the leech on, it chomps away, and it is getting rid of all this excess blood, and it can keep your bit of tissue alive. And you might think, well, this is no long-term plan because I don't want to live with Barry the leech for the rest of my life. But actually, if you can keep this tissue alive for long enough, bodies are just incredible, and you will grow a vein supply into it, or the venous supply that you've got will enlarge and will cope and will accommodate it. So when might we use leeches? Well, the last time I used a leech was when I was doing microsurgery, and a guy had come in with the tip of their finger cut off, and you normally just, you might stitch it back on and just hope it survives as a graft. But because of the hospital I was working at, which was Chelmsford, which is one of the, I've got to say, best microsurgery centres in the world. It's on our doorstep, but it is world leading. It's brilliant. Outside of Taiwan, there's not many places to touch it. Because I was there, they've got leeches everywhere. Not leeches. They've got microscopes everywhere. I had a look at it under the microscope, and I found one little so the finger has two arteries. Very far along, it splits into three, and the artery itself is about 1 millimetre across. When it splits into three, you're in trouble. They're very small, and this had been cut off beyond that, but I found one little artery of one of those three splits. So got their incredible microscopes out, and I managed to get 3 stitches into this 1/3 of an artery, but I couldn't find a vein. So I attached it to an artery with no vein, knowing full well that this was going to become venously engorged. It had to. It has no other way. So we put a leech on it, and it did fine, because a few days later you can stop the leeching. Incidentally, by the way, the leeches love it, but it is their last supper, because for infection control reasons, we can no longer give that leech to someone else. So they're then sort of put in the freezer, and they go to heaven. I'm sorry, all the leech animal lovers out there. And vegans, I'm very, very sorry. In the context of what you had done, if you had a problem with your nipple blood supply, we could have used it, and it was a venous problem, not an arterial problem, then yes, we might have used leeches. But thankfully, I've never actually had to do that. And these days, I have to say, leeches can cause their own problems. They are colonized by a particular bacterium. So if you have leeches, we have to start you on one of about 3 different antibiotics to cover you. And, it's a pain. We have to sort of dress the area with Gelinet so they don't just wriggle off and go walkabout, which some of them do. And leech husbandry can be a bit of a nuisance. And on the wards I'm working on these days, which are not pure plastic surgery wards, the nurses might genuinely get quite freaked out, thinking, what the hell is this guy doing? So there is another way, and these days we can do what's called chemical leeching, where you just scratch the person's engorged bit, and then rub it with heparin, which is a blood thinning solution, and it just makes it bleed and ooze. And essentially you're doing the same thing, but without the leech. But you have to keep going back and keep re-scratching and keep doing it again. So, basically, whenever any of this is happening, we're not in a happy place with your wound, and we're having to give you a lot of care, hoping to get you through it. It only works on quite small tissues.
Are you glad you asked?
Sorry.
It's never a quick answer.
You know what? I haven't been asked that one in so long, but I'm loving it. So there you go. That's leeching. Hopefully we don't ever need to do it. So that anecdote tells me that I haven't had to do it in about 7 or 8 years, I don't think.
It's a long time.
Yeah. So there you
I've
go.
got one more